most difficult adjustment between high school to college for me, besides having so much extra freedom, because structure does help you whenever your schedule's so full, but the biggest adjustment for me was taking on the responsibility of getting my own medication and handling my own insurance and working out my own doctor's appointments to go with my new adult schedule. I had a difficult time at first balancing everything. You really have to take the time to work it into your schedule. But eventually you do get it all together and it's not so catastrophic and disorganized. Eventually you realize if you have to get everything in a row and it'll all work out fine.
To help me be independent when I left home, my parents were very good, especially my senior year of high school, they nagged me less to do my treatments other than a little reminder. And they let me do it by myself because they knew once I left to college, it'd be completely on me. They can't be there for me every day like they were in high school, and it becomes my responsibility once I leave. And them just letting me do my thing and be myself and knowing that, and reminding me that I would have to face the consequences if I didn't do my treatments helped me a lot when I was growing up.
When I first went to college, I enjoyed the freedom of taking on my own health care. For so long, my mother had done it for me. I felt like at times I didn't even know what medications I was on. So really, in taking over my own health care and being responsible for it, I feel like I learned more about my disease. I feel like I'm more in tune with my body. Like, I know when I feel bad, whereas before I would run myself down. And trust me, my mom is still very involved. Text messaging and calling and emailing, and there's not a day that goes by that I'm not nagged at some point.
For parents, the big thing is learning how to actually let go, to let them start taking control and responsibility for their own treatments. And it's really hard to stand back and not say anything, but they need to do this on their own. They'll have to at some point, because if they do find a cure, you want him to be able to be as healthy as possible.
It's definitely harder without the constant reminders from your parents, because when you're in college, there's so much to do, and having cystic fibrosis is like having a full-time job. And so it takes a lot of work to make sure you have enough time in your schedule every day to get your treatments done. And I still get calls from my mom about making sure I do my treatments.
Just in regular conversations with him, how are you doing on your treatments, honey? Are you doing them like you're supposed to be doing? And I know that he told me that he actually does better away from us than he does here when he's up here, because here he gets busy with things, and down there he's actually set a timer on his phone so that it reminds him that he needs to do a treatment, especially in the afternoon. The evening one's the one that tends to get lost sometimes. So he has, I think he said 2 timers, one that goes off around 2:30 or so, and then one that goes off later in the day in case he missed doing it at 2:30. And I thought that was pretty smart.
Make sure that you encourage them just to have the best time they can, be a regular college student, be involved in college life, and just try to have a really positive and good experience with your school years.
Even though I have CF, I didn't want it to limit where I went, but I wanted to be far enough that I could still be independent and by myself, but close enough where I was able to come home for doctor's appointments I could. My biggest concerns were being able to get my medication, because it was so far away from where I was from that I wasn't sure how I was going to get everything on time. But even though my school is 4 hours away, my CF care team is very good about me coming up when I can, as opposed to when I have to. They work their schedule with me, so I'm able to stay on track with everything I need to be on track with.
My primary concerns when deciding where to go to college were proximity to the healthcare team and my accessibility in both my routine visits and my emergency visits. Wherever I went, I was going to have to be able to manage cystic fibrosis. I was going to have to know doctors in the area, or if I could commute to my regular clinics.
I wanted her to go away to college. I was very excited. It's a fun time for people her age, and it didn't matter to me where she wanted to go. I would support her if she wanted to go to any state. And
in my case, I was worried about him getting the medications, but also a doctor in case he got sick down there, and it's 4 hours away, and his getting back up here, would that be an issue? He didn't have a car at the time. So I hunted up the doctor, the person in charge of the infirmary there, and had a conversation with him so that I could figure out what we needed to do and have a plan.
Most institutions will have more or less of the same kind of information to determine eligibility for accommodations. That's always going to include medical documentation, substantiating and/or verifying the need. And once we get that letter, that statement from the healthcare provider, then we require in our particular institution a process called registration, and that's just getting data, emergency contact information, talking with the student about what kinds of compensation strategies they've used over the years that they found to be successful, as well as getting an understanding of what other kinds of support services we may be able to offer and/or provide.
One of the most interesting things that they offered that we never would have imagined is a note-taking service. And so in each of her classes, she has the opportunity to have a designated note-taker.
Some of the accommodations that I asked for were extra time to complete work in case I had doctor's appointments or needed to be hospitalized. I let my teachers know that sometimes I might be tardy to class because it's difficult to get everything done in the morning with the extra treatments and medication.
Investigating, calling the institution, planning a visit as early as possible so that you, one, can determine, is this a good fit for me? Not just academically, but livability. Can I live here? Is this a cool environment? And does it provide for me those kinds of things that I think will make life most comfortable?
Activities that I've participated in at college, we have a really nice recreation center, and I really enjoy doing the elliptical, but they also offer structured classes like yoga and aerobics that are really fun and that are challenging workouts that I've enjoyed participating in.
Some of the activities I do on campus, occasionally when I get a chance, I'll do intramural sports. I've done flag football, I've done a couple of soccers.
Whenever I was in high school, I was always involved in a lot of sports and physical activity because it made me feel great. And once I got into college, my mom actually got me into running. We ran for Team 65 Roses for the first time, and since then we've done 5 or 6 half marathons together. So it's just something that we enjoy doing. I feel like it's so great for me. It's like a natural chest therapy to run around, and we enjoy doing that. It's something that we enjoy doing together, and I think that it's had great health benefits for me.
I have to change my schedule to fit my treatments every semester. Class schedules change, things change, activities change every semester. So the thing that's important is to find time every day at the beginning of the semester to make sure you can get it done. A lot of times my second treatment will come 9, 10 o'clock at night because that's the first time I have any free time when I'm not studying or meeting with a group, or having a social life.
My daily routine for school it's easier than it was in high school because you can adjust your hours in college and have a more flexible schedule. But that being said, it's still a lot to handle, so I just make sure that I make time before school to do my medications, and then I take extra time after school to do medications. You just make time in the day in your schedule for yourself.
The best piece of advice I could give someone with CF going to college is to not forget to do your treatments. That's the hardest thing to do. Taking pills is different. Making sure you have time to do your treatments every day and night is probably the most important thing that you can do. It's what's going to keep you healthy in the long run.
Having cystic fibrosis in college, vending machines are your best friend. I keep change on me all the time because whenever you need a snack, eat. You know, you need to keep your calories up, you need to keep your weight up, it's good for you. So I'm constantly running to a vending machine. I eat on campus. I'm not a picky eater, that's one of my blessings, but campuses accommodate students who are there all day studying and need a quick bite to eat. So always know where your closest vending machine or cafeteria is in school. You won't go hungry. I
found that a school that has a buffet type is best. They have a large variety of foods you can get that gives you all the vitamins and minerals you need, but it also lets you have a lot of food, which means getting a lot of calories, which is also very important to keep your weight up having cystic fibrosis. Some advice to students that are going to college with cystic fibrosis is to not let it limit you. It's something you have to live with day in and day out, and you have to do what you think is best, but you also have to take into effect that you've got to stay healthy too. So it's definitely a compromise every single day, but don't let it control your life. And make sure you eat healthy and eat a lot when you can, and exercise. Exercise is very important, so go to the gym as often as possible. Find a workout buddy. That helps a lot.
When it came to informing my professors about having cystic fibrosis and how that would affect my school life, the Student Disability Resource Center on campus was very helpful in arranging a time where we set up a plan of action for if I were to miss school for long periods of time due to being in the hospital, and how I would make up the work if I were to miss. And then I took that written plan to each of my professors, and they were very understanding.
I shared my diagnosis with my professors. I did it very discreetly. I registered through Disability, and Disability writes a letter for you. You simply hand it to your professor, and there's no need for explanation. The letter, it describes all of your accommodations that you need. It doesn't even specifically say your condition. You can only share that if you choose to. I did not. I just gave them the letter saying that I needed the accommodations. One of the most difficult parts of meeting new people in college is expressing to them your condition, because it's difficult for people to understand. I don't think a lot of people know that much about cystic fibrosis. One of my biggest concerns about going away to college was living with another person who I didn't know and who wasn't familiar with cystic fibrosis. I was uncomfortable about the idea of sharing a bathroom with someone, and even little things like how much of the space my medicine takes up in the refrigerator. I mean, those are relevant issues to me. I try to explain in full my diagnosis, but also I try to tell my peers my specific diagnosis, because the general description of CF doesn't fit every single person. So I try to explain it to my friends so that they'll see how I'm living with it.
When I first started at college, freshman year, I had a roommate in a dorm. And the thing that bothered me the most was I was scared my coughing would wake him up a lot in the middle of the night. But thankfully it wasn't too bad. And after my freshman year, I got an apartment with one of my best friends, and it's been a lot easier since then. At first, I'm a little skeptical to tell people, because I don't know how they'll react. So I get to know them a little bit, they know me, and then I tell them. And a lot of my friends have been very good about making sure I stayed with my treatments and making sure I did them, and I was healthy as best as I can. My roommate has been very good about making sure I keep on my treatments. She will nag me until I do them, and if I don't, the next day she wonders why, and I'll tell her, and she goes, "You can't do that again. You gotta do them tonight." Okay, I'll get them done tonight. So she's been very good about me making sure I stay on top of my treatments and stay healthy.
One of my biggest support systems in college was meeting my roommate, who I've lived with for the past 3 years. I met her in college, and she's become my best friend, my biggest support. She accompanies me to some doctor's appointments sometimes. I've even sent her to pick up my medicine, and she's visited me in the hospital. And she enjoys supporting me. Like, she's a really good friend to me, and we've lived together really well. It's worked out fine.
I have always been very open with the people around me about having cystic fibrosis, so it was not a challenge for me to tell my roommate about cystic fibrosis. I just told her a little bit about what it meant, and told her that it had no impact on her, and she was very understanding and has not had any issues with it. Sometimes you do have to take time when other people are doing things that you want to do, and say that you need to do your treatments instead, and that you can join them when you're finished.
Have a great time. Get involved. Like, don't limit yourself, and don't think that you're limited, but take care of yourself and make that a priority, because when you don't take care of yourself is when you are limited. But you can manage your disease and live a normal, fulfilling life, and also have a great college experience.
To learn more about this issue, ask your CF Foundation Accredited Care Center or contact the CF Foundation directly. Call 800-FIGHT-CF or email us at info@cff.org.